The job description of a personal support worker, PSW, revolves around providing essential care and assistance to individuals who are elderly, chronically ill, or living with physical or mental disabilities. Personal support workers operate in a range of settings, including private homes, long-term care facilities, retirement homes, hospitals, and community agencies, to ensure that their clients can maintain dignity, comfort, and quality of life. Their responsibilities are both practical and emotional, combining hands-on support with companionship and empathy. PSWs serve as a crucial link in the healthcare system, particularly in countries with aging populations or limited access to institutional care. They help bridge the gap between professional healthcare providers and the daily needs of clients who require ongoing assistance. Although they do not perform clinical procedures like nurses or doctors, their role is no less vital, especially in the context of home-based care and community health programs. The scope of a personal support worker's job may vary depending on the client's condition, the care setting, and the specific requirements set forth by healthcare professionals or family members. Nevertheless, their overarching goal remains the same: to assist individuals with daily living activities while promoting independence, safety, and emotional well-being. At the core of the job description of a personal support worker is a strong commitment to compassion, patience, and reliability. Primary responsibilities of a personal support worker. Personal support workers carry out a broad spectrum of duties that include personal care, housekeeping, mobility assistance, and emotional support. One of their most critical tasks is helping clients with personal hygiene. This includes bathing, grooming, oral care, toileting, and dressing. These routines may seem simple, but for someone dealing with illness or disability, such support can significantly impact self-esteem and overall health. Mobility assistance is another key responsibility. PSWs help clients move safely from one position to another, such as getting in and out of bed, walking with support, using wheelchairs, or transferring to the bathroom. This task requires knowledge of body mechanics and the ability to use assistive devices properly to avoid injury to either the client or the worker. Meal preparation and feeding support are also common responsibilities. PSWs often prepare nutritious meals tailored to a client's dietary restrictions and preferences. In cases where clients are unable to feed themselves, personal support workers assist them while monitoring for signs of choking, discomfort, or appetite changes that may need to be reported to medical staff or family members. Housekeeping tasks often fall within a PSW's job as well. These may include light cleaning, laundry, dishwashing, and organizing personal belongings. Although these chores may seem secondary, maintaining a clean and orderly living environment is crucial for infection control and the mental well-being of the client. Medication assistance is another important area, although its scope depends on regulations. In many regions, PSWs are not permitted to administer medication directly but are allowed to remind clients to take prescribed doses, monitor side effects, and document compliance. They may also be asked to report any adverse reactions or irregularities to healthcare professionals. PSWs are also responsible for providing emotional and social support. They offer companionship to clients who may otherwise experience loneliness or isolation, especially elderly individuals living alone. Conversations, recreational activities, and simple gestures of kindness play a major role in enhancing the emotional health of clients. Communication is an integral part of the role. PSWs are expected to keep accurate records of their activities, note changes in the client's condition, and report any concerns to supervising staff or family members. They may also accompany clients to medical appointments, acting as advocates or intermediaries during consultations. Midway through the responsibilities, it is clear that the job description of a personal support worker is not confined to physical tasks. It extends to emotional caregiving, safety monitoring, and consistent, compassionate presence in the lives of those who are vulnerable or dependent on others for care. Essential skills and qualities required. A personal support worker must possess a blend of soft and technical skills to be effective in their role. Compassion is arguably the most critical quality. Clients often face physical discomfort, emotional distress, or cognitive decline, and a compassionate PSW can offer comfort that transcends medical care. Patience is equally important, particularly when assisting individuals who require repetitive instructions or who may exhibit challenging behavior due to dementia, mental health issues, or frustration. Communication skills are vital for building trust with clients, as well as for relaying important information to family members, nurses, or supervisors. PSWs must be able to express themselves clearly and listen attentively to both verbal and nonverbal cues. This helps them detect problems early, such as sudden pain, confusion, or withdrawal. Reliability and punctuality are non-negotiable in this profession. Clients depend on consistent care to meet their daily needs, and delays or absences can have significant negative consequences. A dependable personal support worker contributes not only to the client's well-being but also to the smooth operation of the care team. Physical stamina is essential. The job often involves lifting, bending, standing for extended periods, and moving clients with limited mobility. PSWs must maintain good physical health and know how to use proper lifting techniques and assistive equipment to prevent injuries. Problem solving and adaptability are also necessary. Each client presents unique challenges, and no 2 days are the same. A PSW must be able to respond calmly to emergencies, such as a client falling, refusing care, or displaying symptoms that require medical attention. Being able to think on one's feet, make quick decisions, and remain composed is invaluable in such moments. Cultural sensitivity enhances a PSW's effectiveness. Clients come from diverse backgrounds, with varying beliefs, traditions, and languages. Understanding and respecting these differences fosters trust and cooperation and ensures culturally appropriate care is provided. Work environment and career outlook. Personal support workers operate in diverse environments. In private homes, they may work alone, while in nursing homes, hospitals, or care centers, they are part of larger healthcare teams. Work hours vary widely. Many PSWs work shifts that include evenings, weekends, or holidays, especially in institutional settings where 24/7 care is required. The work is physically and emotionally demanding. PSWs may be exposed to bodily fluids, strong odors, and infectious diseases. They may also witness suffering, terminal illness, or death, which can be emotionally taxing. For this reason, resilience and emotional self-care are crucial aspects of longevity in the role. Despite these challenges, the career is highly rewarding. PSWs often form meaningful bonds with their clients and take pride in making a direct difference in someone's life. For many, the role is not just a job but a calling. The demand for personal support workers continues to grow, particularly as global populations age and the preference for home-based care increases. Career advancement is possible through additional training or certifications. Some PSWs go on to become licensed practical nurses, LPNs, registered nurses, RNs, or specialized care aides in palliative, dementia, or pediatric care. Compensation varies depending on region, employer, and experience. PSWs employed in government-funded institutions may receive benefits such as paid leave, retirement plans, or health insurance, whereas independent or private home-based workers may negotiate rates directly with clients or families. Educational background and training. Becoming a personal support worker typically requires completion of a certified PSW training program, which may be offered by community colleges, vocational schools, or private institutions. These programs cover anatomy, physiology, communication skills, safety practices, and hands-on clinical training. Some employers may accept candidates with relevant experience or equivalent training in caregiving, particularly in areas with high demand. Additional certifications in CPR, first aid, or infection control are often required or strongly preferred. Continuing education helps PSWs remain updated on best practices, especially in specialized areas such as dementia care, palliative care, or behavior management. Workshops, seminars, and short courses can enhance both skills and employability. Conclusion. The job description of a personal support worker outlines a role of immense responsibility and profound human connection. These professionals are vital caregivers who support individuals in leading dignified, safe, and fulfilling lives, often during their most vulnerable moments. They balance the physical demands of the job with emotional intelligence, compassion, and professionalism. For those drawn to service, with a genuine interest in helping others, the PSW role offers not only a stable career path but also the daily satisfaction of making a tangible difference. As the healthcare landscape continues to evolve, Personal support workers remain at its heart, quiet heroes in the homes and care centers of those who need them most.